Last year, I asked my followers on social media, so TikTok, Instagram, and here on YouTube, to give me suggestions for videos that I could make for this year. And the number one request that I received was for me to make a video on hyperpigmentation, different variations of it. So today I decided that we're going to start talking about hyperpigmentation, and this is going to be a 4-part series. It might be more depending on your suggestions, where we're going to talk about different aspects of hyperpigmentation. So stay tuned for the video. Hi everyone, my name is Dr. Fongod. I'm an internal medicine physician practicing aesthetics in the DC metro area, and my practice focuses on treating people of color. So what is hyperpigmentation? Well, if we break up the word hyperpigmentation, the first part of it, hyper, basically means an increase or high, and pigmentation is basically pigment or color. And the thing that is responsible for this pigment is melanin. So the next question you have to ask is, well, what is the function of melanin? So the function of melanin is to protect us from UV radiation. But as we all know, you can't do everything on your own. So melanin usually needs the help of other things in the body to help it protect the skin from UV radiation. And one of the friends that melanin has to help protect the skin from UV radiation is antioxidants. So these two things are going to play an important role in understanding hyperpigmentation. So the next question is, what causes an increase in melanin production? And this is a very, very complicated cascade, but I will do my best to simplify it for you. So I'm going to break this answer up into categories. You have internal things that are causing you to have increased melanin production, and you have external causes. The most common external cause will be UV radiation. So in the summertime, we go out to the beach and we play in the sun, and a lot of times we're going to get a tan. And the reason for that is we have exposed ourselves to UV radiation, and as a response, melanin is going to do its job and protect us from the UV radiation by increasing its melanin production. Okay, so that is the most common way that you're going to have increase in melanin production, and that is from an external source. But the bulk of our problems are internal. So let's talk about it. So there are 3 main categories that are basically going to be responsible for the increase in melanin production in our bodies. The first category I want you to think about is inflammation. And this is so general and so broad, but when you have inflammation in the body, that tends to cause your melanocytes, which are the cells that produce melanin, to overreact, and that will then lead to melanin production. So when do we have inflammation? Let's say acne, for example, or let's say you have ingrown hairs and that causes you to have inflammation. You can have a scratch, you can have a bug bite, you can have irritation in the case of eczema or contact dermatitis. So there are so many different things that can cause inflammation, and whenever there's inflammation, that can trigger you to have elevation in melanin. So it's going to be important to try to manage inflammation in the body. So that's one category. The second category is low antioxidants in the body. So like I mentioned before, melanin cannot do its job on its own, and so it needs the help of antioxidants to also help it protect you from UV radiation. Well, what happens when your antioxidants are low? Usually antioxidants are low because they're being used up to fight free radicals in other places in the body, or there's just a low consumption of antioxidants in the body. Either way, when you have low antioxidants, what happens is the body is going to be like, hey, melanin, you have to pick up the slack, okay? So it's going to lead to an increase in melanin production because its friend is not there to help it out, protect you from UV radiation. So that's another way that we can get increased levels of melanin production in the body. Lastly, hormonal changes. Now, this is a big category, but when we have hormonal changes in the body, it can also lead to increased melanin production. So let's take the hormone estrogen, for example. When you get pregnant, you have high estrogen levels, and that is going to lead to an increase in melanin production. A lot of women would know this as the mask of pregnancy, right? And that usually will go away, but for some women, it lingers on and can then cause conditions such as melasma. So the other thing you have to think about with estrogen is the use of oral contraceptives. For example, if they have estrogen in them, they can also cause you to have increased melanin production. Another time that you might see this is for people who take hormone replacement therapy. So this usually happens after menopause. So taking hormone replacement therapy can also lead to increased melanin production because of the increased estrogen levels in your body. Okay, so that's just from estrogen. The next category of hormones we have to worry about is testosterone. Now, if you have elevations in testosterone, a lot of times that is commonly seen in polycystic ovarian syndrome. One of the side effects or one of the symptoms of PCOS is hirsutism. So hirsutism is a condition where women will develop hair on their body in a male pattern, most commonly on the face. And whenever you have thick, coarse hair on your face, a lot of times that will cause inflammation in the skin. And like we said earlier, inflammation can then lead to increased melanin production, thus causing hyperpigmentation. Another way that testosterone can cause this is because elevations in testosterone can lead to acne. And again, acne will lead to inflammation, which leads to hyperpigmentation. The last hormone I want to talk about, and there are other hormones that can cause this, but this is really important, is insulin. So if you have high insulin levels, hyperinsulinemia, or insulin resistance, this can cause so many different problems in the body. So elevations in insulin can actually cause overreaction of your melanocytes, which can then lead to hyperpigmentation. A lot of times this presents as Acanthosis Nigricans, where you have darkness around the neck, the underarm area, and the groin area as well. And sometimes it can actually show up as hyperpigmentation around the mouth and around the eyes. So that is an indication of insulin resistance. Another way that insulin resistance causes increased melanin production is by causing increased steroid production in the body, which then leads to the production of other hormones such as testosterone. And then the cascade continues, like I mentioned earlier, with excessive facial hair, acne, and those things causing inflammation, and then those things causing increased melanin production. So you see that this is a very, very, very complex topic, and the way that we approach treating it is going to be based on all the different ways in which we're going to have melanin production. So how are we going to treat this hyperpigmentation? So we're basically going to have to go back and look at all the ways in which we produce melanin, or the things that cause us to have an increase in melanin production, and we're going to have to reverse those things. So the first one that we mentioned was UV radiation. So we're going to have to protect our skin from UV radiation. The second thing we mentioned was inflammation. So we're going to have to make sure we work on decreasing inflammation in the body. We're also going to have to try to increase our antioxidants because, like we mentioned before, when they're decreased, that leads to an overproduction of melanin. And lastly, we're going to have to go into the melanin pathway and basically work on decreasing the production of melanin. So in our next video, we're going to talk about skincare for hyperpigmentation. I will also be talking about procedures that we do in the office to treat hyperpigmentation, and also the lifestyle changes that we need to make to treat hyperpigmentation. I hope that you enjoyed this video series. Stay along for the journey. And if you have questions that you want me to answer, please leave them below and I'll be sure to include them in my hyperpigmentation series. So stay tuned and I'll see you on the next video.